My name is Paige Buer, and I'm a physician assistant at Kodiak Area Native Association, and I want to talk to you today about cervical cancer screening. Patients at average risk of cervical cancer should begin screening at age 21, and we generally recommend screening up to age 64. Screening should be done every 3 to 5 years, depending on the type of test that you're getting and depending on your age. Between the ages of 21 and 24, we recommend a pap smear, which is an in-clinic exam that requires us to collect cervical cells. We take that sample and then we look at it to determine if there's any abnormal cells that need any further testing or treatment. We know that the majority of cervical cancer is caused by the HPV virus, and so we can do HPV-based testing for patients that are 25 years and older. Canada now has the option to do an HPV-based self-swab, and the patient can collect this on their own in the clinic. However, it's important to note that everyone has their own personal risk factors, health history, and family history that may require a different screening test or more frequent screening. So it's important to work with your healthcare provider to determine the appropriate cervical cancer screening plan for you. The reason that we're so passionate about cervical cancer screening is because cervical cancer is one of the most treatable and preventable cancers. So if you have questions or if you're due for your cervical cancer screening, please come in, see your provider, and we can have a discussion on what the appropriate next steps for you are.